Greetings, Eric Bakker, naturopath. Thank you for checking out the video. I've got a question here from Sinad Rowandish, or Rawash, something like that anyway. I'm sorry, Sinad, I can't pronounce your surname. It's a bit of a tongue twister for me. Sinad says, I want to tell you something. I have bad candida and I can eat gluten without any problem. But the point is that we as Muslims don't drink any alcohol at all. We don't even know what alcohol smells like. Wow, that's amazing. I didn't know alcohol smelled. Does that got a smell about it? Like, I'm noticing that I have symptoms of candida in my joints, but it makes no difference at all when I eat gluten. I mean, I don't feel any better, but at least I'm not feeling worse. The point is, candida causes leaky gut, but in my opinion, alcohol is the main cause. So, you are correct. Alcohol is one of the main causes for leaky gut, but it's not the top cause. The top cause is antibiotics. Okay, that's the number one cause. But I could spend an hour outlining different scenarios that lead to leaky gut. Most people have got intestinal permeability to some degree, which we call leaky gut. In fact, if you go to Wikipedia, they say that leaky gut is a pile of crap. It doesn't exist. It's a non-existing syndrome. But then on the other hand, if you have a look at the medical studies, they say that intestinal permeability exists. Now you tell me the difference between a leaky gut and intestinal permeability. It's the same thing. These guys just want to have their own way, you know. So, pain in the joints, Sinad. I had an interesting patient last week from England, a man, a 60-year-old male with very bad pain in the finger joints. So, when I saw this guy, I said to him, we need to do some blood tests and we need to do a stool test. And with the blood test, I wanted to look at the typical inflammatory markers that we see with males. Uric acid is a classic example. So uric acid is something that the body makes and excretes normally through the kidneys, but if it builds up, it can create a lot of pain around the joints. So uric acid needs checking out. While uric acid is being checked out, kidney function gets checked, liver function gets checked, and also then I want to look at other inflammatory markers in the blood. A very good one being CRP, or C-reactive protein. You can also go a step further and go for HS-CRP, which means high sensitivity C-reactive protein. And then the other test you do is called ESR, or sedimentation rate. And that has got to do with how fast your blood clots, basically. So the sed rate, CRP, uric acid, these are all good markers for inflammation in the body. And of course, this guy's, all of them came back high. But because he was British, I thought, I'm going to check this guy's iron profile out. Because about 1 in 60 people that live in Ireland and northern England have got a disease called hemochromatosis, or iron overload. So I requested that we check this man's ferritin levels, which is an iron storage protein. Now his ferritin levels were in excess of 1,000, and they should be under 200. In fact, his doctor was shocked when he saw that and said, oh my goodness, you need to go and see a professor to find out what this is. But his silly doctor didn't even test for any of those markers at all. They just basically put him on anti-inflammatory drugs straight away, which, you know, I was dismayed with. So in this man's case, I'm going to be working on cleaning his liver and his kidneys out, changing his diet, and then a stool test result that we did with him showed he had many different types of bad bacteria. Now, these are very often linked up with joint pain, right? I've got very old medical textbooks that talk about with pain in the joints, and especially autoimmune pain, you need to look for the hidden infection. Doctors don't want to look for anything anymore except maybe a glass of wine and a golf ball, but in the old days, they used to spend time with people. The average consultation now in America is between 13 to 15 minutes for a patient. So there's not a lot of time to really talk about stuff, you know, when you've got someone in your room for that amount of time. So you're not really going to find out why they got the pain. You're just going to give them a pill. That's not how we work in my clinic. We try and uncover why people are sick in the first place. Now, in the guy in England, in his case, he wanted a quick fix for the joint pain because it was hurting him. And I said, there's no quick fix. You know, you're might have to stay on anti-inflammatories if it's that painful. But once we clean your gut up, get rid of those bad bacteria, we're going to work with candida remove and restore with this man. We're going to be working with diet change, and we're working with liver and gallbladder flush and kidney cleansing. Once we do all this, over a period of 3 to 6 months, the pain in the joints will be about 80 to 90% less. And this man doesn't have to stay on all these junky medications for the rest of his life, like he's been told he will have to do. Now, what do we do with you, Sinad? I think you should get some blood tests done to find out if there's inflammation in the body through blood testing, and then get comprehensive stool testing done to see if there's inflammation in the gut, right? And then we take it from there, and then we see what the priority is. But generally, joint pain can be ameliorated, meaning made better considerably by cleaning up your diet and digestive system. I appreciate the fact you don't drink alcohol, but Muslims also eat a lot of sugar and fat and butter, and meats and things like this. So you guys do eat good food, but sometimes you eat too much of the wrong food, and that could be causing a problem. So as you can see, there's more here than meets the eye, Sinad. I think testing is what you need. Testing, and then basically get sorted, to see if it can all be fixed up. So I hope that gives you a bit of an insight into joints. You're correct about leaky gut. People with leaky gut often get inflammation, and inflammation can lead to joint pain or depression or many other different types of symptoms. But alcohol is not the main cause, it's antibiotics of leaky gut. Thanks for the question.